I'm here today with Dr. Bill Johnston, who's the ENT presenting on Saturday, the June 26th. And we've just been having a big conversation ourselves about what the presentation is. I'm excited, I'm pumped and ready for it. What are you going to be going through?
Yeah, well, firstly, Brett, thanks for inviting me along. I'm looking forward to coming along and talking with the group. And we're basically going to focus on presentations of airway pathology and how I think my patients over the years have taught me that a poor airway affects their musculoskeletal health, affects their quality of sleep, and that with modern medical sort of aims of looking at root cause, that airway is something we should all be looking at. And I'm going to focus particularly on a group of patients that chronically mouth breathe. When we mouth breathe at night, that has a detrimental effect on our cervical neck posture. It increases bruxism, and it's something that I've really enjoyed treating over a 20-year period with a group of physical therapists and dentists, and with a combination of medical, sometimes surgical treatment, good physical therapy and dental appliances, we've had massive inroads in this patient group. So I'm going to be focusing on that group, but just trying to give the chiropractic group the tools they need to recognise and encourage their patients to start investigating potential sleep or airway problems.
And we were also talking about the correlation between the nasal valve, nasal breathing, how that relates to forward head, upper trap, all these big muscles. Even here, you test nasal breathing. Can you tell me about the...
So when we see patients, we generally categorise their nasal obstruction as to sort of internal or external. So internal pathology can be septal deviations, swollen turbinates, enlarged adenoids, but some patients just have weak nasal alar, so the lateral walls of their nose are weak. So during inspiration they contract in, and they can have a huge negative impact on their breathing, particularly at night. And we tend to refer those patients in-house for nasal function testing, where we can basically delineate whether it's more of an internal mechanical problem or an external problem, which really guides our management.
That's good. So on the afternoon, we're going to be going not just through the theory, but you're going to be presenting cases, showing how the rubber meets the road.
Absolutely.
But also during the afternoon, a workshop. Our Q&A is really going to become a workshop, where we're actually going to go through some of the ways that we can actually examine these things in our chiropractic rooms ourselves, in our own clinics.
Yep, no, absolutely, Brett. We're going to start with simple things that all of us can arrange for our patients, like, for example, getting parents of children to video record their breathing at night.
That's right, yeah.
Starting a patient with sinus problems on a regular saline irrigation. Simple things that can get the ball rolling and make this part of your practice.
And realizing sleep just isn't a one-night occasion. You'll test that over a couple of nights indeed.
Absolutely.
Excellent.
Yeah.
Saturday the 26th, we look forward to seeing you there.